My name is Katie Umfris. I'm a physical therapist here at Benefis, here to answer some of the questions you had regarding falls surrounding our Falls Prevention Week. When it comes to footwear in the house, slippers really aren't a bad choice. If they're falling off, it sounds like maybe they're big, worn out, or just don't have a back on them. So if she wants to wear slippers, perfectly fine. I would just look for an option that has a back that actually comes up. You can actually find slippers that come up a little bit higher on the ankle. So that might be a better option for her. If you're not opposed, you can look at getting a pair of shoes that she can wear in the house. I'd recommend just clean shoes so you're not tracking in dirt or mud. The other thing too, barefoot is okay as long as you're not worried about her slipping. If you are worried about her slipping, but she wants to go a little bit more towards the barefoot route, you can look at socks that have the grips on the bottom. When it comes to accommodating another individual in the house, especially somebody who's elderly, there's lots of different factors to look into. And because I don't know the exact layout of your house or what different obstacles you have to overcome or that individual has to overcome, if there's something that you're specifically concerned about, it may be worthwhile to talk to your father or father-in-law's primary care provider and ask for a home health evaluation just to look at safety of the home if there's something specific you have in mind. Handrail for the stairs is a great option. If the individual is going to be by himself for a while, I would just make sure that the bathroom is easily accessible. So things to look at for safety, is he having to grab onto items to get up off of the toilet, or is the toilet seat high enough that he can get off of it with a little bit more ease? If you feel like he's grabbing for furniture in the bathroom to get up off of the toilet, you can look at installing grab bars in the house. Just make sure they're installed into studs and not just into the drywall. And then the ones that are like suction cup, they don't work quite as well and they're a little bit easier to come off. So really installing grab bars into the studs of the wall is the best option. For other things around the house, making sure that he can get up and down out of the couch or recliner safely. Walking around the house, making sure that there isn't clutter around, so having extra things picked up so there's not shoes laying around. If you have any rugs that are down, making sure that they lay down flat. You can get Velcro or tape to go on the underside of a rug to make sure that it doesn't flip up. And if at all you're worried about it, you can pull the rug up also and just move it out of the way. Those would be the big things that I would look at for home setup and safety. Depending on the mobility of the individual, if you're concerned even about getting up and down up and down the stairs, you can look at maybe a temporary bed down in the main room or on the first level to make things a little bit more manageable until maybe he builds up a little bit of strength. I would say always, though, making sure that we're being proactive instead of reactive is the best option. So although these home modifications are great, really, if you think that there's a concern for weakness or mobility, getting him into physical therapy to get him stronger so he can be more resilient and more independent in his home environment is going to be overall the best option. As far as I know, there isn't anything to attach to a walker to make it a little less slippery on the ice. There are two different kinds of, well, actually, there's several different kinds of walkers. The two main kinds, you have a walker with wheels on just the front, and then you also have a walker with wheels on the front and the back side. So obviously the the walker that has wheels on both the front and the back is going to be a little bit more mobile and potentially a little bit more slippery. The walker that has two wheels on just the front, they can have on the back side either rubber stoppers on the bottom of the two back pegs of the walker, or they can have these slides. They kind of look like small skis. Those skis are going to move a little bit easier than the rubber stoppers. So the rubber on the ice or snow may give you a little bit better traction. Overall, though, I would recommend, if you're worried about walking on snow or ice, cleats for the bottom of your shoes. You can pick them up at most stores in town, and they're relatively inexpensive. There are several options available. If the individual who you're looking at, trying to make a little bit safer for walking on the snow or ice, has trouble with mobility, I usually recommend putting those cleats on the bottom of snow boots or outside shoes that maybe have a little bit better traction, and then bringing a separate pair of shoes to change into when they actually come inside of a building. With those cleats, they get slick if you're on anything other than snow or ice. So on like a tile floor or marble floor or hardwood floor, you're either going to scratch the floor or you're going to slide around a little bit. And they can be a little cumbersome to get on and off of the shoes. So sometimes it's easier to actually change your pair of shoes than it is to take the cleats off and on. So if you just keep them on one pair of shoes, then you can change those shoes when you get inside of a building, find a place to sit down and change them. That tends to work a little bit better. As far as an individual who maybe uses a cane, there is an option for an ice pick that goes at the bottom of a cane. It attaches to the bottom couple of inches of a cane. When you need it, you just flip it down so it's stuck on the bottom of the cane. And then when you don't need it, like when you get inside of a building, you just flip it up and it's out of the way. But otherwise, I'm not familiar with anything that goes on a walker, just something that attaches to the cane. A bit of a potentially loaded question with that, because there are some questions that I have in return. Is your mother falling when she tries to get up? As in maybe she doesn't have the strength to get out of the seat that she's sitting in, or is she having trouble gaining her balance when she's standing, so she falls maybe more when she starts to take a few steps versus the actual standing process? Overall, it sounds like she could benefit from some strengthening and potentially some balance work. There are some seated exercises that can be done. What I would say though overall is it's a little bit more efficient to work on strengthening the activity that she has difficulty with. So although the leg exercises in a sitting position are not bad, she would potentially benefit a little bit more from working specifically on practicing getting up from a chair and sitting back down. So working on more of a standing leg strength to help kind of prep her for that movement. Again, sitting leg exercises aren't bad, but if she has trouble with a specific activity, it's always best to practice that specific activity in a safe environment. So I'll show you a few leg exercises that can be done. If she tolerates adding a little bit of weight or resistance, I would recommend that. Some ankle weights are always beneficial to add a little bit of resistance. Again, if she tolerates it, because you have other orthopedic concerns that maybe you have to consider in adding a little bit of weight or resistance. If at all possible though, practicing getting up and down out of a chair several times a day to work on building strength with that activity is going to be, I think, probably the best option. That can be done with another individual in the house. So of course, then we're maintaining safety. So if she falls when trying to get up, I wouldn't recommend her practicing sitting to standing on her own. I'd recommend practicing it with another individual close. So if she does lose her balance, there's a little bit more stability there. When practicing sitting to standing, if you can do 5 or 10 repetitions at least 2 or 3 times a day, outside of what you already need to do for your daily life, that's going to help build up a little bit more strength for her. So the first seated exercise option that would be beneficial for general leg strength, I have an ankle weight on my ankle right now. So ankle weights range quite a bit in poundage. So you can get some that are only a quarter pound, and you can get up to like 10 or 15 pounds pretty easily. You want to find something that gives a moderate challenge. So when she's doing the exercise, what I tend to shoot for is if you're doing 10 repetitions, at least the last 2 or 3, there's a little bit of a struggle with. If easily you can go through the movement, then the weight that you're using is too light or the resistance is too light. So with this ankle weight strapped on my ankle, you can lift straight up I always recommend a little bit of a hold or a pause, 2 to 3 seconds, nice and controlled on the way back down. The important thing is the control, so nice and controlled up, nice and controlled down. You don't want the weight just to drop somebody down. The second exercise, with the weight still on your ankle, you may have to scoot forward in a chair a little bit for this to get a little bit better movement, but lifting the knee up as high as you can, again, 2 to 3 second hold, nice and controlled on the way down. One more exercise, if you have access to a resistance band, you can loop it around the bottom of one foot and you can use it like a leg press. This would be most applicable to helping with the standing up motion out of a chair because we're pushing the band away like we would push the ground away when we go to stand up. Depending on the individual, you may have to get a band with handles on it or loop the resistance band around the hand a couple of times if there's trouble with gripping or holding on to things. Depending on the chair setup, you may also be able to, if the band is long enough, tie it around the back of the chair so the back of the chair holds it up, and then they can just slip it around their foot and do that exercise. Same thing as mentioned before, working on nice and controlled with the movement, straightening the knee all the way out, coming back nice and controlled. When you're down at the bottom with your knee straight, holding for about 2 or 3 seconds. And then you would repeat all of these on the other side. Falls overall can have a really big impact on somebody's life, whether it's maybe yourself that you're concerned about with your risk of falls or somebody else. Physical therapy can always be beneficial to help build up strength and balance. If at all you have additional questions or you're interested in having a consult with a physical therapist from our office regarding your concerns about fall, don't hesitate to call us. Our phone number at the front desk is area code 406-731-8930.